continues in its journey across our citizens, and we need to take extreme caution in many, many ways. As at last night, we now have 1,791 confirmed cases in New South Wales. This is an increase of 174 new cases over the previous 24 hours. I want to thank health staff, frontline health staff, pathology staff right across this state who have done an extraordinary job looking after people who may or may not have COVID virus, but have achieved at this stage more than 91,000 tests for COVID virus. Sadly, we've also, of course, had 8 deaths in New South Wales. Currently, we have 24 cases in our intensive care units in New South Wales. Last night at midnight, orders that I made yesterday, in conformity with the directions of the National Cabinet, which are the Public Health COVID-19 Air Transportation Quarantine Order, came into effect. Every person who comes into New South Wales must now go into quarantine in a hotel, and if they in any way try to avoid that, they run the risk of an $11,000 fine and a 6-month jail term. This is how serious it has got. I want to thank the New South Wales Police and the Commissioner for the extraordinary work they are doing, joining with New South Wales Health, joining with Border Force and all of the other agencies who are trying to make sure that we, as citizens in this state, stay as safe as possible. The need for that isolation, that quarantine in our hotels is absolutely crucial. We have still thousands of people coming in. They're our citizens, our permanent residents, returning from some of the most dangerous places in the world for COVID-19. So to have this measure will certainly, hopefully, make a huge difference to ensuring those people are not out and about in the community until they are appropriately checked and quarantined for the period of 14 days. I remind the community that from the time that you come into contact with COVID-19, the medical advice is that it takes somewhere between about 1 and 14 days for the symptoms to manifest. Obviously that makes it challenging. Particularly if you have no symptoms at the time, you can actually still be infecting others. It's crucial that we have this quarantine period. I also want to raise the issue of social distancing. As Health Minister here in New South Wales, I cannot tell you how disappointed I am that there is a relatively small but very significant section of our community who think the world is as it was in 2019. It is not. It is not. The fact of the matter is, our entire world has an enemy which is moving through it, an unseen enemy. It doesn't have borders, and it is impacting massively on communities around the world, and it's starting to impact in a way that no citizen in New South Wales or Australia could have dreamed of just 2.5 months ago. So it's crucial. It is crucial that you listen to the health advice, and the health advice is what's guiding the government, what's guiding the Premier, what's guiding other leaders around this country. And the health advice is, you must socially distance. You must. This virus can do its evil best, but it's not a high jumper, it's not a long jumper, and as long as you're 1.5 metres away from somebody else, you have a fairly good chance, a reasonable chance, of not actually getting transmission of the virus. To see what we've seen in some areas outside, and we live in a wonderful country where you can be outside, preferably at the moment. Most of your time should be at home, and I'll let Dr. Sheppeard talk about that in a moment. The Premier's made it very clear. Home is the right place to be, but if you are outside for whatever reason, you just cannot afford to be the person who may actually get the virus from somebody else or give it to somebody else. Every single person in New South Wales should be behaving today as if they have COVID-19, as if they have it. Stay away from anybody that can be, just stay that 1.5 metres away. It's not that hard to ask. It's not an indefinite request. It may go on for months, but it's not indefinite. And it will keep you, your loved ones and others safe. I also want to raise the issue of just being decent Australians. We are a very decent and fair community. We are generally caring of each other. The concept of mateship drives everything that we do, everything that we think about. I am mortified to hear that in some of our hospitals, people are actually stealing hand cleaner and other items that will keep our frontline staff safe. I've even heard of reports of hand cleaner containers being ripped off the wall in hospitals. I can't think of anything more appalling. There are frontline staff who will keep you and keep your family alive, and whoever they are, I'm sure they are an absolute minority, but I'll ask Dr. Sheppeard to just say a little more about that, because she is one of those doctors who really does understand how that impacts both physically and psychologically on our frontline health staff. I think at this point, I'd just like to finally remind people that the community that good hygiene is still at the core of what you need to do. If you're out and about, make sure you wash your hands before you go out. Make sure you wash your hands as often as possible when you are out. And when you think you've washed your hands enough, do it again and again and again. And make sure if you can access hand cleaner, alcohol hand cleaner, you use it, and use it regularly. The advice from health experts is that this virus, this enemy, can hide on hard surfaces for anything up to 4 days. And even that's not absolutely certain, it could be longer, particularly in certain environmental conditions. So if you're out and about, if you're going down a stairwell and holding a banister, if you happen to be in a park and touch some equipment, make sure you don't put your hand up to your face, near your mouth, near your nose, because that way, if you actually clean your hand before you do anything like that, preferably don't touch your face, but I appreciate that that's a very difficult situation. But don't do it. Do not do it unless you have cleaned your hands appropriately, because you could be the next victim, or your family or friends could be the next victim. Now I'm going to ask Dr. Sheppeard to have some comments on these and other issues, and then I'll ask the Police Commissioner, who of course is heading up and doing amazing work. I also should say, as Health Minister, I cannot thank this man enough and his frontline uniformed officers and non-uniformed officers who are out there doing what it takes, again, in a very different world, to keep us safe. People should respect our frontline officers, as they hopefully will do with our doctors and our nurses and our teachers and others who are there. Commissioner Fuller and his troops, his officers, are there to help us and keep us safe. Respect the police when they come and ask you to be a bit more careful on that 1.5 metre distance, or whatever it might be. Listen to what you're being told. Again, it could be your life or your family's life. There has never been a time, perhaps since the last war, and most of that, not all of it, most of it was offshore. This is a war being fought on our shores, extensively, through every part of New South Wales and through every part of Australia. Dr. Sheppeard.
Thanks, Minister. Yes, so to pick up on some of the points that the Minister raised, it is of great concern to our health staff that things like hand sanitizer and masks and gloves are being taken from our health facilities. So I'd implore people in the community that it is our frontline health staff that need to have these supplies. The hand sanitizer is an appropriate thing to use in the community, but people in the community can also use soap and water. So it's essential that these supplies are left in hospitals and that they're there for our health professionals to use, because they're the ones that are at highest risk of COVID if they don't have the appropriate protective equipment and protective measures to keep them safe. I'd also like to speak further about people who are in particularly home quarantine and home isolation. These are, for example, people who returned from overseas in the past couple of weeks, or people who've been a close contact of a confirmed case of COVID. And many of these people are sharing their homes with their family members. And the importance of them practicing social distancing, using hand hygiene, and protecting the others in their household is crucial. Unfortunately, we are seeing cases arise in household contacts of people that have been in quarantine, and so that makes it just so important to follow the instructions on our fact sheets, to have a separate room, spend minimal time together. If you're with your family when you're in quarantine, to wear a mask, to use hand hygiene, and the public health units can supply those things to you if you are in quarantine. And to look out for your health, and at the very slightest onset of symptoms in a person who's a close contact or a return traveller, then to isolate yourselves from others and get tested. So these are the things that we can do to prevent the ongoing spread. With the reduction in people returning from overseas, and now newly returned overseas travellers being in a hotel away from others, that will help us decrease the numbers of cases, but we still have other people who've returned in the past couple of weeks who are still potentially able to spread the disease to their family members if they're not highly careful about how they're preventing contact with other family members. Also, the importance of mental health. So this is stressful for many people, for people in quarantine, people in isolation, and also people whose lives have been affected by the economic changes in our society. So the New South Wales Health has provided additional funding to Lifeline. There's the mental health hotline that has increased capacity since the bushfires, and that has continued. And also the kids helpline, which is available for kids that obviously are finding this current situation of great change very stressful. So I'd encourage all members of the community to take advantage of those resources to help them if they're feeling stress from the situation. And while the Premier is encouraging everyone to stay home, it is still okay, unless you're in isolation, to go outside as long as you practice social distancing. And that can be an important contributor to mental health, to be able to spend time outside. If you're going outside, you still need to social distance, to stay 1.5 metres away from others. As the Minister said, clean your hands before you go outside, and once you come back, before you come back inside. But being outside is okay, and to enjoy our lovely autumn weather, and to walk, and as long as you're keeping away from other people at all times. I think those were the main points I wanted to ask, so thank you.
Thanks, Mr. Hazzard. Thanks, Dr. Sheppeard. Good morning. Can I say the police operation this morning out of the international terminal at Sydney is running extremely well. Police are heading that operation with support from Border Force, Australian Federal Police, Australian Defence Force, and a number of New South Wales state government agencies. We are expecting some 3,300 Australians to return to the airport over the course of today, and as the Minister explained, they will go into forced isolation. It is a security operation that will be run in that vein. People will be processed, normally by Border Force, seen by health officials, and then transported safely to the hotel arrangements, where they will be looked after. They will be treated very fairly, but nevertheless be in isolation for 14 days. Now I can say at this stage there's been just over 1,000 people land on 12 planes. The loads have been around 25% smaller than what we had anticipated. Unsure if that is a byproduct of the new powers that were brought into place, but it's something that we will monitor closely. So at this stage we would expect probably somewhere between 2,500 to 3,000 people to land today to go into isolation. Out of that 1,000 that have landed already, 30 have gone into a high level isolation due to either feeling unwell or having symptoms in relation to potentially coronavirus. But nevertheless, that operation will continue whilst ever those powers are enacted. In terms of a law and order perspective, can I again reinforce with the community that you are safe today. Many of the crimes that we know are down. We know that we've seen reported some poor behaviour, poor criminal behaviour from people spitting on neighbours, spitting on people in the shop, spitting on police. We will continue to respond quickly and arrest these people and bail refuse them. But again, this is not the majority, this is the minority. You are safe to go to the shops. You are safe to go about your business. We would just ask that you heed the health warnings. If we listen, if we keep our distancing, if we isolate wherever we can, then we will be out of this much, much quicker than perhaps other countries. And whilst in Australia it does feel as though that this is not real, when today they're reporting over 10,000 deaths in Italy. So believe me, it is real, and we do need to take this seriously. Kids need to take it seriously. I mean, there's no better time to be a 16-year-old. You can stay in bed all day, you can sit in front of the TV all day, you don't have to leave the house. Please take it seriously. Mothers, fathers, parents, neighbours, we've got a role to play in this. We've got to be role models in terms of what the behaviour is. Local governments have an important role. You manage the beaches and the parks. If there's a 30-degree day coming, you need to close the beach 3 or 4 days out. You need to prepare, you need to plan for these things. It's no longer worth waiting for the day. Talk to your local area commanders, your officers in charge. We can work with you. We can help pre-plan to ensure that we don't have big groups on the beach or in parks over the next number of months. So for us, the police, we're still 17,000 strong. We are out there, 4,000 civilian police employees. They're all turning up to make sure that you are safe. But I need you to listen to the warnings as this emergency rolls on. Thanks. Any questions?
What exactly is...
There's been 11 fines handed out, and I wouldn't expect that to grow given the fact that now people are going into isolation. But nevertheless, we are still enforcing those pre-Saturday night who should be in self-isolation as returned foreign travellers and all those who have had the virus.
How do you find the people having
At this stage, the fines are relevant to the warnings that have gone out. So that are businesses that have been closed. That is on the government website in relation to more than 500 people on a beach. So that is out there. In terms of the safe distancing, that is something that it is a health initiative to try and minimise. So there's been 11 tickets. If someone has been a ticket that they feel is not in the spirit of the legislation, we are certainly happy to look at that. But nevertheless, if you're travelling with a child, then please put the child in the back seat. We have to do everything we can to keep our distance, and the Minister and the Doctor have been so clear on that, and the Premier has been crystal clear on it.
What exactly is happening at the Swiss Hotel in Sydney? The residents or people in quarantine are reporting that they're not being treated very well.
Look, they were put under security under the Bio Act, which is a federal government act. It is under control of other agencies. Police are helping provide security in relation to that. I spoke yesterday. I know there's some people that will be unhappy with the bed, the pillow, the heat of the dinner and all those type of things, but the reality is that they're in a hotel room, and yes, they will be isolated for 14 days. That is for their own protection, the protection of their family members and the protection of the New South Wales community. We can only take and listen to their complaints and try and reconcile them, but they will get proper health treatment, and we're putting in lines for them to call if they have issues. There's police on site, health professionals are available. We're doing everything we can to make it comfortable, acknowledging it won't be as good as home.
Commissioner, we know that there was a group of 33 medicos that came in from Chile on Friday night, and they decided that they wouldn't self-quarantine. They breached those warnings and instructions. What can you tell us about that situation, and what's your reaction to that?
Yeah, I'm disappointed. I am disappointed. My understanding is that the orders hadn't been served on them at the time, so we may not be able to issue them with infringements. We are looking at that. The doctors should know better. We all really know now how serious this is. It's my understanding we've been in contact with everyone, and they are all in self-isolation now, either back in hotels in Sydney or in their own homes.
Of those who arrived today, how many were taken to hospital, if any?
At this stage, none have been taken to hospital, but 30 have presented with either an advanced temperature or feeling unwell. They are in a high level of isolation with health people at the moment. They've undergone corona testing, which takes 6 hours, so they will remain in that higher sort of health testing area in a high level of isolation until we get to the bottom of it. If any of them felt unwell and they needed to be hospitalised, they would be rushed to hospital.
Just on the incident at Northmead, we're hearing various reports about the motive behind it. How concerned are you about mental health playing a part in similar types of incidents cropping up?
We understand we're asking people to self-isolate, whether that is someone coming back in from an international flight, or someone living on their own. We understand this, and this is why the state government's put $10 million extra into Lifeline. That's why 1,000 additional staff will go on the Services New South Wales phones. There are numbers to call. They are still open. They're still active, whilst there are lots of government...
And this is where we leave our viewers on ABC's main channel. You can continue watching on the ABC News channel.
If you have a pre-existing mental health condition, your GP is still there for you, and you will have your own arrangements, and please use those. Be confident in talking to your GP if you have existing arrangements. Otherwise, Lifeline and the other government agencies are all still there to support the community.
We saw some of those residents in the Swiss Hotel having a go at police officers, telling them to stay in their rooms, to get back in their rooms. Is that something you worry about in terms of the community confronting your staff on the front line of this war?
Look, policing's a challenging job. That's why we have some of the highest levels of response for our own mental health. But at the same time, at the moment, the community need us. They need us to be strong. That doesn't mean that we don't have our police chaplains out there. We have our own phone lines to call. We have our own medicos as well, and we are concerned about the welfare of our workforce. But I think it's also a time that the community will be pretty happy their police force is standing up protecting them.
Mr. Hazzard, can I ask some questions about how...
Sorry, you want to come back?
I just wanted one more.
One more third.
You've been branded the COVID commissioner. I'm guessing a month ago you couldn't have imagined you'd be in this situation. How are you coping with this sudden, massive responsibility? Yeah, look, it's why you've trained me. 32 years of policing. I've run many operations and been involved in planning of New Year's Eve and a whole range of different things. So it's why we're here. It's why people say to me, why do we have 17,000 police, 4,000 police civilian employees? Well, we have all this because sometimes things go bad, and when things go bad, you need people to stand up, and I couldn't be prouder to be part of it.
Mr. Hazzard, what are the arrangements that are in place for these hotels and quarantine people returning? Let's start with the workers in the hotel. Are they being given special training?
I think I actually have to let our COVID commissioner answer those, because he's actually I'm dealing with the health issues, obviously. So,
what about those doctors?
Hang on, we'll answer this first.
Oh, okay, sorry.
Slow down. Yeah, it's all right.
So in terms of the process is that the passengers are received at the airport and they're processed normally as we would expect. They're seen by health professionals, which is entirely important. Then they're escorted by either Border Force, Defence Force or Australian Federal Police in buses normal government buses into hotel rooms. Now, at the hotel rooms, there is a mix of response, but New South Wales Police will take responsibility of securing those assets. The individual passengers will be isolated to their rooms, and food and beverages will be brought to them. If they need any health support, then we will call health. Part of this is having a health plan, whether that's a doctor, a nurse, or whether that is an ambulance for urgent extraction. Those things are in place. Hotel workers won't have to have hands-on contact with anyone. All they have to do is bring food, etc. to them. Now, the hotels understand what is at hand here. They have put their hands up to help. We are working with them in relation to this. So the workers are coming in, they should be properly briefed, and they should have the PPE that they need. Now, we know that the virus doesn't survive the most basic cleaning. So, yes, we'll be taking it. Okay, so they're not going too bad. There'll be some people after the bushfire still living in tents and caravans. The people are going okay. Thank you.
Minister?
Yeah, Minister.
Sorry, Brian, yeah.
I
Brian.
was just going to ask you about those doctors. I saw you nodding earlier. I mean, it's a really poor call for them to basically decide they're going home.
I think I actually don't know what to say about those doctors. They should have known better, and I think they knew that they were being given orders that were being prepared by New South Wales health staff at 4:30 a.m. Our Dr. Chant and her team were up literally all night. They knew they were coming. It's bitterly disappointing that they actually chose to ignore what is a safety measure for themselves and for others. I guess they are the people who you would expect to know better than anybody else. So yeah, it's bitterly disappointing.
Public spaces around the state closed.
I think the message is very clear. The safest place to be, as the Premier has said many times, is in your own home. But obviously, in terms of mental health issues and other issues, as Dr. Sheppeard has also pointed out, if you do need to go outside, that's okay, provided you comply with the rules. And the rules are, if you're in any sort of group, it should be a 4 square metre group, but anywhere else, it should be 1.5 square metres. Keep yourself safe, keep your family safe. It's just ludicrous that people think it's okay to stand outside a coffee shop. The chairs have been taken away. The message is pretty clear. There's often tape up saying, you know, don't use this area, and yet they're still standing there shoulder to shoulder. Some of my fellow Australians I'm starting to wonder about, because maybe it's just they don't get how serious it is. This is really serious, and it could be you, your family, your friends. If you need to get your coffee, get it, and then clear off.
Where's he going with it?
Sorry, one at a time.
Ask about blue scope
I just didn't hear that, sorry.
Blue scope steels for Canberra plant. Should we be concerned if restrictions are strengthened that would shut down given they supply 80% of the
There's no current intentions to shut down businesses, and the National Cabinet, they're obviously the body who makes these decisions and gives advice. to each of the state and territory governments. But certainly at the moment there's nothing that's proposed in that regard, and certainly the balancing act, as I see it, is that National Cabinet is trying to weigh up the health issues and the economy and trying to make sure there are jobs there. And as has been said, any job at the moment is an essential job. Yes, sorry, you want to ask something?
I was going to ask a question about stage 3, or the next round.
Well, that's what I was going to ask.
Yeah, the next round of businesses closing.
I think it's fair to say. I think it's fair to say that National Cabinet, which is effectively a wartime arrangement, is working through it, and I respect, as Health Minister, the advice that I get from the National Cabinet, and I think it's appropriate for each of us to allow them to do their work as this disease actually gets its way in further and further into our community. But I'm not going to preempt what the National Cabinet would do. One final question, and only because it's Brian.
Is it inevitable? Is it just a matter of time, or is there a chance that we won't go that extra step?
I think that's a matter for the National Cabinet, and I, as Health Minister, would just say that I, along with all the frontline health staff, indeed the Police Commissioner and his frontline staff, and the Border Force staff are all working extremely well together, and we will do whatever it takes to try and keep our community safe. But now it's up to the community to do whatever they can do to keep themselves, their family and friends safe. And it's about time. It's actually past the time when they should be doing that.
Thank you.
Thank you.